Hello, I'm Valerie PA, and it's a pleasure to welcome back to IOHR TV Orlaith Minogue from Save the Children. Welcome, Orlaith. What is the current situation in the camps that you work with, and what's their approach to coronavirus?
So currently, Save the Children and other humanitarian actors are engaged in what is essentially a race against time to prevent the spread of COVID-19 into the camps where we work. We know that refugee and forcibly displaced children and families are particularly vulnerable to the potential impacts of the virus, both as a result of reduced access to health services, nutrition services, but also as many already have potentially weakened immune systems. For example, we know that a severely undernourished child is as much as 9 times more likely to die from a common infection than a well-nourished child. So we're very concerned about what any outbreak of COVID-19 in refugee or displaced persons camp could bring. Just in the past week, we've had confirmation of cases in Cox's Bazar camp in Bangladesh, the largest refugee settlement in the world. What this tells us is that there's no time to waste either in Cox's Bazar or any other refugee camp situation. We know that the health services in those camps need strengthened, and that needs to happen very quickly. Critically, we also need to make sure that the essential services that are already being provided in those camps are not prevented from continuing because of mitigation measures around the virus. So children and their families in camp situations are often, in many cases, entirely reliant on the humanitarian community to keep them fed, safe and protected. And we need to find new and safe ways to make sure we can continue to do that while keeping our staff and those people in the camps as safe as possible.
How is Save the Children responding to this crisis on a global basis?
As a global child rights organisation, Save the Children's ambition is to place the rights of the most vulnerable children at the heart of the COVID-19 response, both Save the Children's own response, but also calling on the international community to do the same. We are currently responding to the crisis in 87 countries around the world, and our staff are seeing firsthand the impact that measures for restricting the spread of the virus are having on children. So, for example, reduced access to education, disrupted health and nutrition services, as well as reduced family incomes. All of these are combining to have a negative impact on the vulnerable children that we work with. And so our key priority is ensuring we can continue to support that population in new and innovative ways to make sure that we can safely meet their needs.
Do you think it would be possible to stop mass infection and potentially catastrophic death rates in refugee camps?
I think it's very difficult to anticipate what will happen in camps. Prevention is certainly key, and we're seeing in a number of circumstances that the local authorities are putting in place the kind of restrictive measures on movement and access to camps that you would hope to see in terms of making sure that people are not unwittingly carrying the virus into camps. However, where the challenge lies is that this population is very often entirely reliant on the humanitarian community and on the services and goods that are provided to survive. And so what we need to do is to ensure that we can continue life-saving programming while also complying with the restriction measures that are in place. So this is a big challenge for the humanitarian community at the moment, and actors are working to adapt programming to see where they can do it at distance, to see where a different approach can be provided, perhaps one-on-one services rather than group services. It's going to be very difficult though, and prevention, as I say, is key, but in terms of response, we know that the infrastructure to respond safely just isn't in place in terms of adequate medical equipment, in terms of the kinds of provision of personal protective equipment, ventilators. The issues that we're seeing play out all over the world will be very much exacerbated there.
Specifically, in the refugee camps, what kind of measures can be put in place to prevent infection?
So our first approach to this is making sure that people have the information that they need, so that people living in camps understand what the virus is, how it spreads, and what are the steps that they can take to mitigate that spread. We need to make sure that that information is available in the language that those people speak, because of course very often in camp situations people don't necessarily share a common language, or they don't speak the language of the country that they're resident in. So that's one step. On top of that, of course, ensuring safe and sustained access to clean water, to adequate sanitation infrastructure. All of this is very key and is a major challenge in many of the camps that Save the Children work in. So humanitarian actors on the ground are certainly taking steps to improve that access and to make sure that people understand how important it is. But there are major challenges to that. Finally, I would say that health services are very often underfunded and under-resourced within camps. Most camps, safe to say most camps are located in low-income countries or fragile countries where the health provision in that country more broadly is often not where it needs to be able to safely respond to the virus. And all of those restrictions and all of the limitations on that will be exacerbated when it comes to camps and camp residents.
There are already 20,000 cases of coronavirus in Bangladesh. You were talking earlier about Coxs Bazar, which is the world's largest refugee camp for the Rohingya there in Bangladesh. What hope is there for protecting them against coronavirus, and what's Save the Children doing to help make that happen?
So Cox's Bazar is the world's largest refugee settlement, and sadly in the last week we have learned that there are confirmed cases in the camp. Save the Children is working in a twofold manner to try to meet the needs of this population. One is in relation to the prevention, detection and management of COVID-19. We're working to strengthen some of our own health programming and health services. And then the second way is making sure that the essential services that we have already been providing to this community can continue. We do education provision, child protection work, all kinds of programming that we consider to be essential and life-saving to this community who is entirely reliant on humanitarian actors for their needs. So we're calling on the international community to ensure that the funding, resources and support needed to urgently build some kind of response into the provisions that are available in the camp. That needs to happen very quickly, and Save the Children will be a key part of that effort.
What sort of funding does Save the Children need to succeed, and how can global campaigns help to raise the support?
So the funding for this coronavirus response globally, the funding requirements will be massive. Earlier this month, the European Union and a number of other donors came together into a pledging conference, and $8 billion have been pledged for a COVID-19 response. However, I believe this is just a start to what's going to be needed to make sure that a lot of the gains in terms of child survival, in terms of gains we've seen in the vaccination of children, in the education of children in many developing countries around the world, to make sure that those gains aren't rolled back due to the restrictive measures being introduced to contain the coronavirus. This will be something that requires a lot of funding, coordination and effort on behalf of the UN and others. And Save the Children will certainly be part of that response. People are struggling everywhere with this virus, and so I think people understand that it is a shared concern, and I think a lot of what we have seen in terms of the response by the public is an outpouring of support and community spirit, and we hope that will extend to people in other contexts, in vulnerable contexts around the world. So I think once people are made aware of the situation, of how vulnerable people are and what can be done to help, that there are steps that can be taken to adequately protect people, we hope to see that people will step up and respond to that where they're able to do so.
What's happening to the displaced people in Syria outside the camps that cannot be reached?
So at the moment, there are high numbers of displaced people inside Syria in different parts of the country, many displaced as a result of serious fighting that took place earlier this year, particularly in northwest Syria. Many of those people find themselves living in overcrowded shelters, in camps in the open. This presents major challenges for this population in terms of their sanitation, their access to hygiene items, their food security, access to food, affordable and nutritious food. All of this this population was already extremely vulnerable, and now all of this has been compounded by the restrictions that have been put in place around movement, around commercial activities, in an effort to contain the arrival of and spread of COVID-19. To date, there has been no confirmed case of COVID-19 amongst that displaced population. However, testing capacity is low, and so we only know the numbers for those who have been tested. It's very possible that there are cases out there that we're as yet unaware of.
Now, let's talk about testing, because it's fundamental during this outbreak. Is testing available in refugee camps that you work in?
So whether testing is available in refugee camps varies from context to context. That depends on which country the camp is in. It depends on what humanitarian actors are present in that camp, whether the WHO is present and active there, whether the authorities in charge, be it local or national government, have the capacity to respond and to provide some testing. What I would say is that by and large, this is very limited. It's very limited provision and absolutely not adequate enough to be able to do the kind of testing and tracing support that is being recommended as the best way to contain the spread of the virus. On top of that, there are difficulties in securing personal protective equipment, in securing ventilators and the other kind of medical equipment that is required to adequately respond. And so these are challenges that are common across refugee camps and anywhere where there are particularly vulnerable populations.
The last time we had the opportunity to speak to you a few months ago, we were discussing the situation of international women and children who joined militant groups and are now being held in refugee camps of Al-Hol and Roj in the northeastern part of Syria. Do you know what their situation is now and what's happening on the ground?
So at the moment, there remain more than 10,000 women and children from over 60 countries who are trapped in 2 camps in northeast Syria, in Al-Hol and Roj camps. Those are sprawling, overcrowded camps with limited infrastructure in terms of health provision, education provision, nutrition services, etc. So the issues that were raised several months ago about the difficult conditions that people were living in, those continue to persist. Now, of course, we have the looming threat of COVID-19 and what it might mean if the virus does reach the camps, hanging over the population there. So what would be best for those women and children now is absolutely to be repatriated to their home countries. We have seen governments take steps to repatriate their citizens that are stranded abroad as a result of the reduction in air travel. And we would ask them to consider this particularly vulnerable population when they're making those logistical determinations. It has been demonstrated that it's possible. A very sick French child was repatriated in the last month. And so, practically speaking, those repatriations can take place. We just need the political will for that to happen.
Children living in refugee camps are often malnourished and have not been vaccinated against diseases. How is Save the Children protecting them?
So yes, an issue with children living in camps is that in many cases they will have weakened immune systems from living sometimes for many years without adequate health services. Malnutrition is also a major concern when there is restricted access to nutritious food available in camps, whether there's a functioning market, whether actors are able to continue to provide the kinds of food baskets that children need to recover. This is a huge concern for Save the Children. What we are attempting to do is to continue in as safe a manner as possible to test children for malnutrition, and in some cases to teach people how to do tests for things like malnutrition at a distance. We're calling on the international community to fund vaccination efforts, to fund health and nutrition programming, both in the immediate term in terms of response to this crisis, but also as a wake-up call that the vulnerability of this population is pre-existing this crisis. This, if anything, demonstrates that we need major, massive public investment in these services to make sure that children can withstand the spread of this kind of virus.
In the Horn of Africa and across into Yemen and beyond, there's an unprecedented swarm of desert locusts which are threatening the food supply and livelihoods of millions of vulnerable people. Save the Children is already fighting on so many fronts. What will you do to tackle what has the potential to become a mass famine in the next couple of months?
This is a huge issue of concern for Save the Children, and we're working closely with governments, the United Nations, and partners across the Horn of Africa to ensure that nutrition screening and health programs can continue, despite the challenges posed by COVID-19 restrictions. Adaptive initiatives are taking place, including remote training of nutrition staff, protection, promotion and support of breastfeeding practices, etc. So the potent mix of COVID-19 restrictions, in many cases flooding, and then also the threat of locusts means that children and families are facing this unprecedented threat of food restrictions, of famine, and of really having a devastating impact on their lives. We're also working with communities to prepare for the potential risks that they face. So in anticipation of what might happen to food security should a second wave of locusts take place, as we are expecting in the coming weeks, we're delivering cash to more than 50,000 households so that they are able to provide their family with the essential items that they need to survive. And so Save the Children has context-specific responses in each of the countries that will be affected in place to do what we can to help to protect children and their families from what's to come.
Thank you, Orlaith Minogue. It is always a pleasure to have you on IOHR TV, and we are very, very grateful for the work that you and Save the Children do. Thank you.
Thank you. Thank you so much.
Thank you so much for being with us for another episode of IOHR TV. Stay safe.